So I'm very pleased to announce that today we have Professor David Paton from Nottingham University, who has done a lot of work on COVID suppression measures and has analysed both vaccine mandates and lockdown and looked also at the ethics of those. He's tirelessly worked on all of these areas, both throughout the lockdown and beyond. And so I'm very, very pleased to speak to him here today, as he has so much knowledge in this area. Welcome, David, and thank you for coming. Firstly, could you just explain a little bit about what you do?
Yes, so I'm an economist. I work at Nottingham University Business School, and I've looked at lots of sort of policy evaluations in a range of areas. And when COVID sort of started, it was straight away something that interested me, particularly in terms of analysing the data and looking at how that married with the messages that the government were putting out in terms of interventions. And then also in the interventions, economists tend to look at sort of costs and benefits. And quite early on, I became a little bit concerned that the government were thinking mainly about focusing on, well, if we do this, we're going to reduce deaths perhaps, and we can talk about whether that was really the case, but no real appreciation of the costs that some of the measures were doing. And you've mentioned some of the work on the ethics of lockdowns I've looked at. So I guess my sort of starting point would be, of course, what's important is what's right or wrong and our fundamental rights and freedoms. That's not me as an economist, just me as a sort of ordinary person. But the thing that economists can bring to that is that any sort of policy intervention needs to at least be aware of the costs and benefits when you're coming to decisions about what's the right thing to do.
Well, we had something which I've spoken to lots of people, and recently to public health ministers about this, and they would argue that the costs and benefits were unknown at that time because we had a novel virus and we didn't know the infection to fatality rate. You've looked at that question, haven't you, in terms of the ethics, whatever the infection to fatality rate? What would you say?
Yeah, so I suppose it depends which way you look at it. So the government, is talking about, well, we've got to be cautious and think about risks. But that works in both ways. So you're right that there was maybe lots we didn't know about the COVID pandemic and how infections would go out. We did know quite a lot about the likely costs of interventions. We may not be able to put a number on it, but we knew that if we shut down schools, there would be a huge hit to children's education and other effects on children. We knew if we shut down the economy, there would be a huge economic impact, a massive hit to government expenditure, which would have consequences for many years. We also knew that big economic hits like that can have broader social consequences in terms of isolation, suicide, substance abuse, and so on. So it's not true to say that we had no idea about the costs of these interventions. What we didn't know quite so much about was the likely benefits. But we did have some established public health ethics, which were generally accepted. And this is one of the things I talked about in my article on ethics, which was written with a professor of ethics. So, I brought this sort of economics and data analysis to it. We had a professional ethicist working on it too. And the established principles were, you have to be careful before you go for an intervention, particularly an intervention that takes away freedoms of, basic freedoms of people. And the sort of criteria you might look at, you've got to be really confident that you're going to have very significant benefits. You should be also very confident, have good evidence that those benefits will not just exceed, but significantly exceed the costs. So you've got a really overwhelming case for intervening. And thirdly, you've got to be really sure that when you do things by law, you force people to stay in their houses or you force businesses to shut down, that you could not do that with a less intrusive measure, that you could not achieve the same impact with more voluntary measures. When you look back, even at the time of the first lockdown, we had good evidence that none of those criteria were met. We did not have the evidence that we were going to have a really strong benefit. In fact, there was a lot of evidence when the first lockdown came down in England that infection rates were already coming down, or at least sort of peaked. We had really strong evidence that the costs were going to be huge. We did not have good evidence that doing things by legal mandate, forcing people, was going to have a bigger impact than doing it voluntary. In fact, the voluntary measures that we'd had up to that point, largely, if anything, may have had some effect already. We knew that people tend to respond. They see people dying, they're concerned about, the risk they might give to other people, and they do react voluntarily. So in fact, none of the ethical criteria were met even for that very first lockdown. When you come to lockdown 2 and 3, when we had very strong data that the benefits were very minimal of lockdown type approaches and the costs were enormous, I think then it becomes an overwhelming case. We knew that the costs were not going to exceed that were very significantly going to exceed the benefits.
You say that these are accepted ethical criteria, and you mentioned in one of your papers that the Department of Health had produced a 6-page report stating some of these ethics, and other people had written on it. But it's not mandated, is it, in our kind of constitution or in our public health system that these ethics should be adhered to, or am I wrong about that?
No, that's right. So we had an established pandemic plan, and part of that was sort of based, largely on the sort of Childress approach to ethics. That's the sort of accepted principles. So I think we can say they were generally accepted in the public health and government.
Just mention who Childress is. He was someone that had written a document.
That's right. So it had established some, sometimes called the Childress principles on ethics in public health and when it's right to have a sort of intervention that is mandatory and what principles. So, you've got principles and then you've got, well, how do we apply them to a particular situation? And of course, there can be some debate about that and, what sort of situation, what was, the general principles are very, I think, broad and sensible, that we look at costs and benefits. We have a sort of bias against mandatory interventions because, of course, they can lose trust in public health and they're very costly themselves. You've got to get the police involved and pass a law, and there's all sorts of things there. So, and of course, that has an impact on our, fundamental rights and freedoms. So I don't think they were that controversial. What was controversial is that the government seemed to ignore them when it came to COVID. So we had this sort of, generally established advice from the World Health Organization as well, which didn't really envisage formal lockdowns, mandatory lockdowns and that sort of approach. And those approaches were abandoned. Now, the thing about principles is that, you use those principles when you're in a situation that's fast changing, that's has lots of unknowns. That's when you need your principles, because the principles are there because, of course, in a fast changing situation, we know you face pressure. So at the time in sort of February and March, early on, it looked like the government was sort of sticking to the more generally accepted approach of being a little bit cautious before you have very costly interventions. And of course, there was pressure. People saw people dying from COVID, and we could talk about whether deaths were over or underestimated, but that people saw people dying from this new infection, and you had this sort of public pressure and pressure put on from people like Piers Morgan on television and so on. That's when you need principles, and that's why it's important you have ethical principles that are your first port of call, because it's easy for governments to say, oh, we've got to be seen to be doing something, so we'll intervene. Remember that interventions can make things worse. So it's not automatic that just because you have a problem, you have to do something where this thing is a very radical and something we know is very costly in all sorts of areas. It's not enough to say, yeah, we've got to do something. That's the point where you think you go back to the ethics and you say, well, that comes first. The government seemed to take an approach that sort of the end justifies the means. So we're told by scientists that this intervention will reduce deaths by lots. Actually, that wasn't the case. As we know, the evidence, when it ends up, these interventions didn't have a big impact on mortality. But the government were saying, well, the end justifies the means. No, it doesn't. Actually, I think public ethics should come first. What is right or wrong? And actually, you tend to end up with a better outcome by having that approach in all sorts of things. Vaccine mandates being an obvious one. The government.
We'll pick up on vaccine mandates in a minute, because I'm really keen on that. But given the very terrifying prospect of all the deaths that Neil Ferguson had modelled, then could you not argue that the end did justify the means, because the only evidence that was presented to them was so horrendous, and therefore he advised a lockdown, as you've reported, in February, March 2020, because it would save so many lives. And once we'd done that, if we did that quick, hard, and early, we could have avoided subsequent lockdowns. What do you say about that?
Yeah, certainly Ferguson did. So he presented this model which suggested that without lockdowns, hundreds of thousands of people, more people would die from COVID. Health services would be overwhelmed, and that people would die from other diseases because they wouldn't be able to be treated in hospitals. So, I think the only possible case for lockdowns would be for a very short period if you genuinely thought you were going to avoid hundreds of thousands of deaths.
But given that he said that to government and other people, as you've said, he was very influential, wasn't he? Given that scenario, and it's easy to judge things with hindsight, surely then there's a justification for these measures because of the dramatic effect on the health system.
So we're talking really about who is to blame for this huge error. Is it Ferguson or is it government ministers? Well, I think we've got to look at a couple of things there. Firstly, what Ferguson said he did indeed was pushing for lockdown, but you look at his models, they were it simply excluded the possibility that people would react voluntarily. There was no account of that sort of approach. Okay. Now, whose fault is it that that message didn't get through to government? Well, we can put the blame perhaps on their scientific advisors, on the chief medical officer or the chief scientific officer. But ultimately, it's also ministers have a responsibility to explore some of these things. So just because somebody says we've got this model and hundreds of thousands of people's lives will be saved by this, doesn't mean that government have to automatically say, oh, OK, we'll throw out all established plans and ethics and go ahead with this straight away. I think there is some responsibility to think, OK, well, what is right or wrong? What are the consequences? Even if Ferguson was right, you then look at the huge costs of lockdown and those interventions. And actually, you look at some of the cost benefit analysis, even had Ferguson was right, it's not clear that the costs of lockdown would probably still have exceeded the benefits. But government ministers can't avoid all responsibility because they took no effort to look at both sides of the equation. Further, you look even in early March 2020, there was evidence even then that Ferguson models were not realistic. So you had data from the Diamond Princess, the cruise ships, where they had a very early outbreak, which looked at showed a very different evolution of infection and overall infection rate than was suggested by Ferguson. You had that very early data from NHS triage data that the government had access to. And we can argue whether it's their fault or their advisor's fault, but that information was there and it was clear. So Chris Whitty has already admitted that the R rate, so this rate of increase of infections, was known to be decreasing even before that first lockdown. So I'm afraid it's not quite enough to say that we thought hundreds of thousands of people were going to die from, if we didn't lock down in that very early stage. I'm afraid there was evidence that wasn't the case. There was no effort to look at costs and benefits. The government explicitly excluded ethical approaches, ethical analysis and criteria from that decision making, which would have held them back. And then if we take it a little bit further, even a couple of weeks into lockdown, it was clear from the data, and this is why I was looking at the data at the time, that deaths were going down much earlier than they thought they were, implying that infections had already decreased several weeks earlier. So around about 13th of April, we could see that in the data. The government was still, for weeks after this, in their daily press conferences, and the chief medical officer and scientific officer were saying, oh, deaths are still increasing. So you had this disparity between what the data was showing and what the public were being told. So that's where I think, the excuses were a little bit thin, that we knew better. I think we did know better even at that stage.
You looked at lockdowns as well throughout and the impact of those. Many people would argue, well, they did save lives, but you've done a lot of work on that or looked at other people's analyses of that. Did the lockdown save many lives, and how many do you think they may have saved?
Okay, so there's lots of aspects to that question. The first is, did lockdown reduce infections, COVID infections, and therefore reduce COVID-related deaths in the very short run? That question, I think we can't completely answer. So the sort of the strongest evidence, so you look at these sort of meta-analyses, there's one done by Johns Hopkins University team, where they sort of look at all the different studies, because of course, like lots of questions, you can find one statistical study that finds one thing, one that's another. There's different levels, there's better and worse methodology. So you look at the strongest methodological studies and look at, well, when lockdowns came in, did deaths go down faster or slower than before relative to other places? And that strongest evidence says that probably on average, there was a very small decrease in COVID deaths, maybe about, from a strong lockdown, perhaps about a 4% decrease in COVID deaths. But that comes with a range of uncertainty, like all statistical studies. So we can't rule out that lockdowns had no impact at all, even on short-run COVID mortality. But probably the best guess is that there was a small reduction. Certainly nowhere near enough to sort of, counter even the lowest possible estimates of the costs of lockdowns. But then you have to take a broader impact and say, well, what's the impact on deaths or health overall? Now, lockdowns may reduce COVID mortality in the short run, but did that just delay some COVID deaths? We know when lockdowns were lifted, you may have just sort of then had the increase. So it was just a question of timing. Then also, we know that lockdowns have effects on other sort of deaths from substance abuse, we know that economic hits have recessions cause an increase in mortality rates. We know that lockdowns themselves led to people not getting treatment for other things and also delaying getting checkups and hence having interventory treatment at an earlier stage. So the best studies also look at the overall impact on excess mortality. There's not so many studies that look at that, but those that do suggest that lockdowns, if anything, led to an overall increase in mortality, but certainly didn't lead to a decrease in overall mortality. So I think our best evidence at the moment is that lockdowns probably increased mortality overall, but possibly had no overall impact. We can't be certain, right? With any statistical evidence, there's always uncertainty. And that, I think, is quite devastating because it's telling us that, even if there was no costs at all, which of course is wrong, lockdowns did not save lives overall. Even if they sort of, saved some COVID lives and caused some other deaths, overall they did not save lives and maybe, caused an increase in mortality.
So that is non-COVID deaths. Lockdowns had an increased effect on non-COVID deaths. That's the analysis that you've.
That's right. And that increase outweighed, if anything, or at least balanced any decrease in COVID-related deaths. Yeah.
And has anyone sort of looked at where those deaths were, what they were? And presumably
So these studies look at excess mortality. So it's, you don't necessarily go into detail about where they are. And, there's a big question about whether, COVID deaths really were COVID deaths. In some cases, they may be misclassified. So this measure of excess deaths is quite powerful, but it does make it harder to say where they came. But then there has been more data now looking at impact on, for example, delays in cancer treatment. We know that people being told to stay in their home and health services are going to be overwhelmed. That did to people going to get treatment or get checkups for cancer, and that would have led to an increase in deaths there. We know that there were impacts on, for example, substance abuse in during COVID times. Increase in alcohol, people staying at home and perhaps drinking too much or relying on drugs. So those things are much harder to pick up because they tend to have long-run impacts on mortality, and it's very hard to really establish cause and effect. So I suspect we will probably never know the overall impact of lockdown on people's health and mortality. So the sort of studies I was talking about was really looking at short-run excess mortality. So would have picked up some of these, delays to treatment and so on, but probably are underestimates of the impact of lockdowns on mortality, but it's really hard to know for sure that sort of cause and effect.
And you don't know the order of magnitude of this ratio?
That's right. People can look at sort of long-term, what's the impact on long-term excess mortality? And then we get into all sorts of debates about, is there impact of long COVID? Is there impact of maybe some vaccination side effects, as some people think? And that's really hard to sort of separate out. So I don't think we can get to the bottom of that.